My name is Erlito Patidungan from St. Augustine School of Nursing, Iloilo branch under the caregiver program. Today, I'm going to demonstrate a range of motion exercise. Range of motion exercise that are performed by the patient himself or by a nurse in case of helpless patient to mobilize. All joined through the full range. Range of motion exercise are those in which a joint is moved through full range of motion according to its capacity. There's two types of range of motion. The active, done by the patient herself or himself. The passive, or done with help of assistance from another person. The purpose of range of motion to increase the muscle strength and the endurance, to minimize the physiological function, to prevent a complication caused by immobility like control torch. Control torch. Contractors to improve the physical activities or to increase joint flexibility. Before we need to move the arm exercise, need to hand wash or sanitize our finger or using the gloves to prevent the bacterial infection. First, we need to take out her hands, just only, and this is the shoulder exercises: flexion, extension, flexion, extension, flexion, extension, and this is the abduction, adduction, abduction, abduction. Mali. After the abduction exercises, I need to move the rotation of the shoulder, but I need to move this a little bit to the side and making sure you have a 90 degrees of the arm in the body. And this is the inward rotation, outward rotation, inward rotation, outward rotation, inward rotation. Next, we need to move to the elbow. Flexion, extension, flexion, extension, flexion, extension. And this is the hypernation and pronation. Hypernation, pronation. And this is the supination, pronation, supination, pronation, supination, pronation. Now we're moving to the west. Flexion, extension, hyperextension, flexion, extension, hyperextension. Turn your hands and the radioflexion or the flexion or on flexion. Radioflexion, on flexion, radioflexion, on flexion, radioflexion, on flexion. Now I'm going to move the thumb. Abduction, adduction, abduction, adduction, abduction, adduction, flexion, extension, flexion, extension. And I'm going to move the position of the little finger. And then fingers going to, this is the abduction, adduction, abduction, adduction, abduction, adduction, flexion, extension of the finger, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Now we're moving on. We just need to expose to one leg, and first we're moving for the only one leg to need one leg to need to expose one. First, we're working on the hips. And this is the flexion, extension, flexion, extension, flexion, extension, abduction, adduction, abduction, 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 adduction, outward rotation, inward rotation, outward rotation, inward rotation, outward rotation, inward rotation. Next, to the knee. And this is a flexion, extension, flexion, extension, flexion, extension, flexion, extension. After that, we're moving to the ankle. And this is the plantar flexion, dorsal flexion, plantar extension, flexion, dorsal flexion, plantar flexion, dorsal flexion, inward rotation, outward rotation, inward rotation, outward rotation, inward rotation, outward rotation. Now we're going to move to the toes. Abduction, adduction, abduction, adduction, abduction, adduction. And we're going to work each of the toes individually. And this is the flexion or the extension exercises. Flexion, extension, flexion, extension, flexion, extension. And after that, all the exercise or range of motion, remove the back properly the bed within the 30 degrees in the comfort position, and report and record, and remove all the gloves and dispose on properly. Thank you.